Sir, please start.
Good evening. Today's class is the most important. I think so. Because many more times you have asked to discuss failure case. You also tell me that you are always discussing the successful case. And request me to discuss failure case. But you see, the case I have discussed, it is failure case for others, but not for me. So, how can I describe in front of you the failure case? All the failure cases are successful with me. But today's class is so important, very important. So, I will discuss in third Sunday in Bengali, this class. Everybody should know regarding these topics. And it is, I can say, the universal approach for any therapeutic scientist, that means any physician of any therapeutic science, they are having many more cases, unsuccessful cases, failure cases. But I always discuss with failure cases, but the cases are successfully treated. Failure with others. I have discussed 12 points on these topics. And that many 12 cases are incurable for other therapeutic system, not with real homeopathy. And I feel when you treat following my instruction, and after that you see no expected result, then you are disappointed. It is very matter of great regret that without knowing well, without reading with analytical mind, you think that, yes, what you know about real homeopathy, it is. What can I say? It is enough. Like this. Homeopathy was known to Sir Emmanuel, and now it is with others. Between this animal and this physician, nothing is there. So this type of idea you are also having. What Sir has told, I have done all these things, but no expected result. That is, the real homeopathy is all bogus. But you never think that. I am doing this laborious job for more than 45, even till today, till night. Just half an hour ago, I was thinking with this idea. But after doing nothing, you want to 100% successful, as you are a fool. It is quite impossible. You have to read, you have to practice like me. And after a lot of failure case, then you will learn from the case. What should you do? Without doing all these things, you consider yourself You are the authority. That means you have done everything, but no result. Then you become disappointed with real homeopathic system. I have told you many more times. I have learned many more things from correctional home, means jailkhana. After spending till today more than 10 lakhs rupees, I have spent it. Till today I am spending only for learning. Now you consider yourself what you are doing for learning real homeopathy, for being a successful real homeopath. What you are doing? You are doing nothing. You are only thinking when that success will come. Nothing will come. Behind gaining success with real homeopathy, you have to do many more things. You may get many more things after giving many more things. But you are not doing that. Again, you are telling, yes, I know very well real homeopathy. According to my consideration, you have no idea with real homeopathy, actual real homeopathy. Hydrophobinum, sorinum, Glossarate. Use of all these things is not real homeopathy. I have told you. My driver practicing real homeopathy. He treats many more his relatives, his friends with real homeopathic medicine. Then what is the difference between you and my driver? Nothing. Your idea is so poor, I can tell you. And again you are telling, sir, there is so many failure cases. That is why I am very interested for taking this type of class. Previously, I was not sure what I will do in this Sunday. And now I am telling this class I will take in Bengali in next Sunday. Next Sunday means third Sunday. Because I have so many students, they have very poor idea in English. So I have to take this class in Bengali as because this chapter is universally important. As you are having so many failure cases, I am telling like this way only to make you understand that many more things you have to learn. Till today, what you have learned, I think it is less than 1% of real homeopathic idea. So you should not consider your failure case is failure for the real homeopathy. It is failure for you only, not others. With the help of real homeopathy, you can do many more things. What I am proving day by day in different type of patients. Today I have seen, I don't know how many cases I have seen in Chagda OPD. One case was there, she was not responding immediately after taking medicine. Otherwise, all the cases, they were feeling good immediately after taking medicine. Lots of complicated cases are there in Chagda OPD. If you think all those cases is failure cases for others, they have come to me from different therapeutic system after taking medicine of different therapeutic system. And they are disappointed with modern procedure, with classical homeopathy, with Ayurveda, everything. They are disappointed with therapeutic system. After listening from someone, they have come to me. Even from Calcutta, they have come to Chagda for treating. Because in Calcutta, there is 50,000 Now here it is only 1,000. So they have come here from Chagda to here. Chagda, from Calcutta to Chagda. It was very interesting with me that I am going to Calcutta and they are coming from Calcutta to Chagda. Someone is telling, sir, you are going to establish institutional hospital in Chagda. It is far away from Calcutta. Who will come? I smile at them. If they, when the sun during daytime, no cloud can overlap that very sunlight. I think the God-gifted divine idea will expose itself like sunlight from different parts of the world. The physician will come to learn what is the mystery behind this. So let's go with the subject. See the name of the subject regarding importance of the state. No change. No change means failure. See the next line. The state no change is observed in few cases, especially failure. Here I have mentioned 12 cases, 12 type of failure. That means 12 type of no change. So we are going to share. I am going to share with so many failure cases, but the case is successfully treated. It is failure for other therapeutic system, physician of other therapeutic system. All the 12 type of situations are failure, indicating failure case, but it is successfully treated with real homeopathy. Let's do the first one. The case has been treated with the help of different therapeutic system, including real homeopathy, without any expected result for prolonged period. See, physician of other therapeutic system tried their level best to give relief to the suffering individual. Not only others, including real homeopathy. Means a real homeopathic physician also tried with their level best. They have, everybody has this treated the case for prolonged period, but without any expected result. That means failure case. But let me describe this very 12 situation, then I will tell the remedy. Listen very carefully, please. Second situation. The case is declared incurable by the physicians of different therapeutic system. Yes, from hospital, from nursing home, from other physicians of different therapeutic system, they have declared, yes, it is incurable one. Take your patient at his or her residence. No way for treating this very complicated patient. So you also tried, you are trying your level best, then you are not finding any expected result. So it is failure case. Third situation. The case is declared surgical, but the physical condition of the patient is not suitable for that. That means no scope for surgery. The condition of the physician is so grave. So, failure case. When the aged person, either male or female, having gallbladder, calculus in gallbladder, and advised for immediate surgery, but the condition of the physical condition of the patient is not suitable for the surgery. So failure case. You may try with your system. No response. So failure case. Surgery has been completed successfully, but there is no relief as such of suffering. Another situation. The physical condition was suitable for surgery, and surgery has been done successfully, but there is no relief as such of suffering. And you also tried with your system, no relief, so it is failure. The patient has been suffering from multiple metastatic carcinoma. After surgery, radiotherapy and chemotherapy are unable to produce permanent relief. So everything has been done. Especially, you will see in case of brain tumor, they will tell, yes, we have tried our level best, but complete surgery is not possible in this case. So, radiotherapy should be taken, advised radiotherapy, but after radiotherapy, the situation is worsening, not relief for that. I am having such type of brain tumor case. I think I have told you. They have operated many more. Growth was in the brain at the surface of fourth ventricle. And after doing that, they told, that means surgeon told that it is quite impossible for completion of operation of all the different small tumor. So the case is incurable. The case is failure, but the case is treated well under my treatment, successfully. The patient has been treated with real homeopathic therapeutic system for prolonged period without any remarkable change. I have heard from my different student, sir, this case is not responding with real homeopathy, and what you have taught us, I have followed well, and no expected result with real homeopathic treatment. So it is failure. According to the student's idea, he has done everything. That means he knows very well about real homeopathy. Then why the result is not produced? Because the Real homeopathy is bogus, so nothing can be done with that. So it is failure for real homeopathic therapeutic system. Psychiatric patient is not responding well with real homeopathic treatment. Sir, Sinhalji has told many more times. Sir, you please tell how many short period, within how many short period you have treated psychiatric patient. So I have to tell. Sir will not try with proper real homeopathic knowledge. May it be, Sir has tried with this very patient with real homeopathic medicine, but no response. So it is failure? No. I will tell the medicine later on. There is no action which real homeopathic medicine is observed in case of addict patient. Medicine was given, real homeopathic medicine, according to my instruction, but no relief. The patient is very interested for addiction. So no result. That means failure case. You will tell, okay, let's proceed with others. The patient has been suffering from allergic rhinitis. Yes, very painful. Was for me also. But now the case is responding. That way, allergic rhinitis is obstinate case. Very hard to give relief, but not failure. Next. The patient is responding well with symptomatic treatment. Sorry, patient is responding well with symptomatic treatment. Yes, not well, not. When they are taking treatment with classical homeopathy, the symptomatic treatment, the patient was good. But as the symptom is reappearing time and again, so the patient is disappointed with classical homeopathy. After that, patient has come to me for real homeopathic treatment. So as it was failure case, because the patient was responding well with classical homeopathy, but not with real homeopathy. So it is failure case. The patient has been treated with steroid for prolonged period. So you will not get easily the expected result. That means it is failure. The patient has been suffering from genetic disease, not responding with any medicine. So failure case. 12 situation within 1 hour and 30 minutes, I have prepared this class. Previously, I thought what I will do today. I should stop the class or not. But I cannot stop myself. That is why within 1 hour and 30 minutes, I have done all these 12 points. I tried to find out the 12 points for failure cases. Now, come to the point. Yes, this is the 12th problem with which the case is declared failure. Yes, all the 12 points is failure for other therapeutic system with modern medicine, with classical homeopathy, with Ayurveda, and everybody, with yoga, with pranayam, all. The failure case. Let's go. How we can try with that? For becoming successful with all these incurable situations, first you have to think over the state of no change. Yes, very clear. No change means no aggravation, no amelioration. That means the system is showing this one, the thumb. You will not do anything. The system of the patient is showing the thumb. It means you will not do anything. So I want to stop sharing. The harmful group of gene showing the physician the thumb, because that very harmful group of gene want to show that you will do nothing for this 12 situation. Yes, it is very right. You have treat the case beyond the prevailing system of real homeopathic therapy. That means in real homeopathy, there are many more treatment protocols. And you have tried all the protocol, and it was decided nothing will happen. So failure. But one thing you know very well, that the system of the patient is not responding. What it means? It indicates that the system of the patient is too much exhausted, is highly exhausted, is unable to receive the stimulus of the medicine. The failure case means this. The system is not responding. Then you have tried with different protocol, different time. Sometimes 5 doses means CM 203 to 1. Sometimes 16 doses, that means 15, 18 like this up to 60. You have tried with 500 1 M10 means 4 potencies. But no response. It does not mean that you have done everything. Better to tell you have done nothing. Because beyond this, many more things is there for doing, for becoming successful with these all failure cases. But problems are so many, but solution is one. What is that? You have to make the system of the patient energetic. And this can be done only with Sorainam lower potency. You can start with that will be 5 potency, CM 200, 0/3, 0/2, 0/1. But you will see no response. Then you will tell, sir, no response with your instruction. What it means? It means system is exhausted a lot and you are unable to give stimulus. To give stimulus, you have to prepare the system of the patient for receiving the stimulus of the medicine. For doing this, you may use it every 30 minutes, every 1 hour. That very different potency of Surina. Not higher, only lower. You may start with CM 203 to 1, or better to start with 203 to 1, 203 to 1, 203 to 1. With 30 minutes interval, with 1 hour interval, but you have to use it. But you should not stop allopathic medicine, modern medicine. Then the patient will irritate, the patient will disappointed. You have to apply, you have to allow all that previous treatment with which patient is improving very little. Yes, very little. They are getting relief from modern medicine because every few hours the patient is bound to take that very medicine. And you also are not doing anything with your medicine. I have told you, because the system is exhausted enough for getting stimulus from your medicine. So you have to give the extra stimulus to the patient for receiving this one. But it is not so easy because the patient is bound to take the modern medicine or Ayurvedic medicine or others, or medicine of classical Ayurvedic therapeutic system. Like in the morning, Salpar, in the evening, at night, Nagdomika, or anti-allergic medicine every 12 hours or 24 hours. Or inhaler. The nose is obstructed at night. So patient is bound to take that very nasal drop, with which patient can sleep very well. So they are very much interested, and you should not stop that. If your medicine is able to work enough, then patient will not take that very nasal drop or inhaler. But it is not possible within a very short period. So you should not be disappointed with Ayurvedic treatment. You have to use Sorinam, lower potency, for prolonged period. Every day, 4 potency. Every day, 4, 5, 6 potency. 203 to 1, again 203 to 1 if it is needed. Before sleep, you have to allow 203 to 1 Sorinam in a day. So many times, even with 30 minutes interval, 1 hour interval, when you will see little stimulated the system of your patient. So 2 hours interval. But you have to tell your patient, you please take your allopathic medicine if it is needed. But you know very well, you are taking the medicine for prolonged period without any permanent effect. Patient will agree with you. But you have to use Sorinam lower potency for prolonged period. And time will come, you will get the result, and patient will be satisfied with your treatment. Yes, sir. Previously, I would take the inhaler every 3 hours. And at every night before sleep, I was bound to take the nasal drop. But now it is not so important for me. What it means? It indicates that the system of the patient is responding with your medicine. The system is now energetic for getting the stimulus from your medicine. So when there is a case of failure, When you are disappointed, you should not stop. That will be so right now. Yes, patient may be disappointed with you, but your duty is to make them understand that if you take patience, you will get the permanent relief. But it is not so easy as you are treating yourself or your patient with prolonged period, with different steroid. That is why it is taking time. I assure you this, I want to tell you that you will understand your patient will give you pain for how many time, how long period. You will understand. When you will ask, if it is little baby, then you have to ask its mother. During pregnancy, have you taken medicine for prolonged period? The patient may tell yes, patient may tell no. If it is yes, then it indicates that the baby is also treated for prolonged period during pregnancy. Its mother during its pregnancy. So you have to consider that the patient is treated for prolonged period with other therapeutic system. That means the patient will give you pain for treating that very individual. The numbers of times, the numbers of days patient is treated with other therapeutic system, even with real homeopathy, the patient will give you pain for prolonged period. Patient will not respond to your medicine. In that case, you will feel disappointed, but you should not. You have to understand, you have to analyze the situation. And by only one medicine, it is possible. You have to use according to the need of the system of the patient. And you have to decide how many minutes interval you have to apply medicine. That very Suriname of lower potency 203 to 1. Maybe sometimes 200 is not responding, so 3 to 1. You may use a day many more times. Within 30 minutes, so you may consider how many doses is needed. If it is 1 hour interval, how many doses is needed for the day? When the situation is good, you can use it too early. So the situation will tell you how you have to proceed. But no question of disappointment. No question of failure. No question of failure. Mind it. And for that, you have to teach yourself what I am telling today. I will tell all these things in next third Sunday in Bengal. But when you will confuse, then this class you have to learn many more times with that very recording. I will tell Mona to give this very English version to the app. But mind it, your hard labor will give you peace, both you peace and your patient with your hard labor, hard thinking, analytical thoughts, but no question of failure. You should not consider the cases. And when the patient party will tell, sir, is it possible to do anything for this type of patient? But you should give answer instantly, immediately. Yes, it is possible. Lest you can consult with me or your colleague or like this. But instantly you have to give answer. Yes, it is possible. But when patient will see you are thinking, so they will be disappointed with you. And if physician is, the doctor himself is thinking, so it is quite impossible for him. So they will not allow time for it, your treatment. So mind it, how you have to behave with your patient part or patient. And you will see, when you will give answer with confidence, patient will give confidence from your answer. Yes, this physician is suitable one. So problem is more. I have discussed it 12 situations. If I can remember, then I will tell you. Otherwise, this 12 situation is enough for a discussion of failure cases. And I have told you how to overcome this very situation. And you have to overcome the situation. If you get this type of patient, please tell me what you are doing, what is the result, and you can consult me with your case also. But procedure is this. If you ask and if you do not give proper answer to me, then I will be disappointed with you. Then I will tell you, yes, you are unable to do anything. You are not a patient worthy to do it. So you have to do hard labor for doing all this failure situation successful. If you want to ask on this situation, I am ready to give answer with your for your all the question. So you can proceed with your question.
So can I ask a question?
Yes, sir.
So what was the follow-up on these 12 patients? Can you please enlighten us?
Pardon?
What was the follow-up on these 12 failure cases with your large experience?
How can I tell you? I have told you first. If you are not educated well, then the case is failure. If you are educated well, then that very failure case will be successful. So you have to try yourself, not from me, not from my experience. It is quite impossible.
My question was, did you got success in these 12 cases by this repeated use of low dose
12
Sorinum?
cases, no 12 cases, 12 situations.
Yeah, situation, right. So did you get success? Did you get success by repeat?
You have had so many cases from me. For 6 or 7 cases in at the back side of my book. And just now 3 cases I have discussed with you. That very ankylosing spondylitis, cirrhosis of liver, completely blind cases I have shared with you. All the cases are considered failure for other physicians of other therapeutic system. So I have done it successfully. So we have to do it after proper learning, proper knowledge of real homeopathy, but not superficial knowledge of real homeopathy, serious knowledge of real homeopathy.
Let us say a patient is not responding after hydrochlorobinum, cephlinum, and drosera. Is it all right to try Sorinum for that case and then go further?
No. This is superficial knowledge regarding real homeopathy. You have to try all 8 medicines of different potencies.
And then go to
Then
Sorinum.
you can try with Sorinum, not before that. You have to try all 8 medicine, 5 potency,
as per schedule.
4 potency.
As per schedule told, no?
Yes.
Sorinum will come, CVCA, after that Sorinum will come.
So that is another thing. That is another Sorinum. After CVCA, Sorinum will come. After Thujan Bodinam, Sorinum will come. This Sorinum is another. But the Sorinum I am talking today, that Sorinum is separate one. You have to use this Sorinum 200, 3 to 1 repeatedly, even 30 minutes interval. 1 hour interval every day. Without any interval, you have to use that. But why? What is the science behind this? The science behind this is the system is completely exhausted with other therapeutic system and also with different medicine, different potency of real homeopathic therapeutic system also. And you are using 8 medicine of different potencies. This can the procedure is enough to give uh, exhaustion to the system of the individual. So real medicine also is enough to becoming the system of the individual exhausted. So it does not exhausted means no change means it does not mean the other therapeutic system has done all this wrong thing. Your medicine, that means my medicine, my 8 medicine of different potency means 5 potency, then 16, it is totally 25 potency. The 25 potencies of 8 medicine you have to use fast. Then you should use that very Suriname, what I have described in front of you, the knowledge I have described in front of you. And my teacher is my patient. So I respect my teacher and I have learned from a lot. I have learned a lot from them, day to day practice. It is not learned from any book or anything else.
Can I clarify one more thing, sir?
Yeah.
So let us say that we have tried all the potencies as you have explained to us beautifully, systematically. Patient is not responding. And then we try this repeated Suriname. Now, we probably assume that all the medicine we gave before, they will be in the system, I think. But because the system was exhausted, they were not acting. So Suriname will allow them to act again. And then you can restart again.
Yes, but not in the beginning. You have to use You have to use it so many doses. Till the system is energetic.
Okay, can you give us
overcoming that very exhaustion? Yes, sir, please.
Can you give us a pointer at what point, how do we know that now the patient is energetic? So we can stop Suriname and do other things.
No, time will come, you will understand very easily. Patient will tell, and your experience will tell you that the system of the patient is now in stable condition. Then again, you have to start with 5 potencies of different medicine.
Yeah, that was my question. Just give us a hint. What will make you feel patient is stable and energetic and now is ready for other remedies?
When after using Suriname with many more doses, the situation will tell you. The system is...
Can I tell about one case of?
Yes, let's go.
Can I talk about one case of Dr. Anil sir?
Yeah.
Recently, what I have got a COPD case. 9 doses I have started. After that, when I reached Suriname, little relief. And Suriname now 15, 18, 20 getting relief. So she got relieved. Actually, she was using inhaler for 4-5 times in a day. But now a single time inhaler is taking and 24 hours with our medicine getting relief. So after that, now 20, when I not showing result, then I came to 100, 500. And after that, not showing result, then 03, 02, 01 getting relief. Now 03, 02, 01 getting relief, 3 cycle of 03, 02, 01 I repeated. After that, not relief, then again I started 9 dose again and patient got relief. Now no inhaler.
Yes, this is the way for learning the system of the physician, system of the patient is now energetic, is able to take the stimulus from the prescribed medicine. And it is possible when the physician will use the procedure, then only it is possible for knowing that this is the procedure to give energy to the exhausted system of the patient. But I want to tell you one thing again, that no question of disappointment. You have
No
to
question of disappointment. Actually,
try time and again with that very
100
medicine Sorainam. Regarding this idea, I have got it from Clark Dictionary. I am really thankful to the Sir Clark for his dictionary of Mathematica. There is very little sentence, but I have learned all this idea from Sir Clark. This is very
Sir, what was that sentence?
Pardon, sir.
What was that sentence in Clark's Mathematica of
If
Suriname?
you read the book, it is not memorized, but you will get it in the first page.
Okay. Thank you. I'll look at into it. Thank you.
Yeah. And if it is not there, then I will tell you in which line it is written. I will count the line and I will tell you.
Thank you, sir.
Welcome. So, any question from anybody regarding failure case? You have asked me many more times. You please discuss failure cases, failure cases. But how can I tell you failure cases? Failure cases for others, not for me. And for it, all of you, those who are not reading well with analytical idea, then you will tell, yes, sir, it is failure case, failure. But
is Dr. Praveen here today? Is Dr. Praveen here today?
Here, but Praveen is very late comer.
Can you give us some feedback?
Praveen has entered into the class.
Praveen, give us some feedback.
Praveen is not at all serious regarding real homeopathy. You should know, Dr. Sinhalji.
That is not good.
Praveen is not serious. Jana is not serious. So I do not name them. I am lucky, I think. Praveen has joined the class, but Jana has not.
Dr. Pranav is doing a good job. He's following all your instructions, sir. I discussed with him.
Actually, Praveen is a teacher, he is an examiner, so he is busy with his works. He is busy with his business, own business. He is not so busy with real homeopathy. And why it is needed? He is getting almost lakhs of rupees, 1 lakh rupees in a month. So why he will give pain? He will get pain for learning real homeopathy. Real homeopathy is possible for them, those who are earning money with hard labor. Those who are earning money very easily, so it is quite impossible for them for learning real homeopathy. They are disappointed very easily. And they will claim that real homeopathy is all bogus. So let me say good night. Next, on third Sunday, I will take the class in Bengali, as because everybody should know this thing well. So let me say good night.